Assalamualaikum and hello everybody. My name is Dr. Ahmad Ramzan bin Yusuf from OMFS Department, Queen Elizabeth Hospital. Today I'm going to show a little demonstration on a minor oral surgical procedure, which is the incision and drainage under LA. Incision and drainage is a minor surgical procedure to release pus or pressure buildup under the skin from an abscess. So an abscess is a pus production as a result from bacterial infection primarily from the teeth. For incision and drainage, it involves application of antiseptic solution on the skin, followed by a small incision or puncture on the skin to let the pus flow out from that local area. There are a few things you need to take care of before the procedure. First, you have to have informed consent from the patient. Secondly, you have to inform the assistant on what procedure you are going to do. And lastly, you have to have a correct instrumentation for the procedure. For IND procedure, since it's going to be done under local anesthetic, you're going to need at least a cartridge of LA with a syringe, scalpel blade, preferably with blade number 11, which is pointy, scissor, curved artery, needle holder, Gillis forceps, suture scissors, non-resorbable suture, rubber drain, antiseptic solution which is the povidone, and of course some gauze for the dressing. For the purpose of this demonstration, we're going to imagine the orange as a left submandibular abscess. We're going to start off by application of antiseptic solution, which is the povidone on the skin, application of local anesthetic, small incision with exploration using the curved artery, and then we're going to put rubber drain and finish it off application of dressing. Before we start the procedure, we have to pick the suitable location for the incision, which is the lowest point following the gravity. Usually will be around this area, to make sure the pus can flow accordingly. Then we start off by putting the antiseptic solution on the skin, which is the povidone, with the help of your assistant. To apply the antiseptic solution, we start by applying it inside and moving it outside of the area, and let it dry for a few seconds. Next, we give the LA infiltration to the area. Make sure it just goes superficially in the skin and leave it for a couple of minutes. The next step would be the incision itself, preferably using blade number 11, which has the pointy end here. We make a 1.5 to 2 cm incision on the skin. And then by using curved artery, insert to the incision that you have made just now and try to puncture the abscess area, going in and open up the curved artery. Go in every direction to make sure you puncture all the locules. As you notice, there are already some fluid coming out. You can do some massaging around the swelling area to make sure every pus will come out. So the role of assistant at this point is to do suctioning at the opening or using the dish to collect the pus. So you need to be very gentle. At this moment, it's going to be very uncomfortable for the patient. When everything is clear, do a rigorous flushing using normal saline from the opening of the incision. The next step will be the placement of rubber drain through the opening of the incision to allow the leftovers of the pus come out from the side. Make sure we have the correct size of the drain. This is a little too big, so we have to cut it. By using the curved arteries, you can put the drain into the opening. This will make sure the remaining of the pus can come out from the side. To secure the drain, this is when we use the suture. You can secure the rubber drain to the skin by using the suture. And now the rubber drain is secured. This will allow the remaining of the pus to pass through this opening. You can do more flushing using normal saline through this opening to flush out all the pus out. Lastly, we're going to put some gauze dressing on top of the drain. If you think the drain is too long, you can always use the scissors to cut it off. Then you can apply dressing. It is important to call the patient every day to do flushing with normal saline. When the patient comes to your clinic, just open up the dressing and do the flushing through the opening, and then replace the gauze with a new one. At the end of the treatment, when you review the patient and you see there's no more pus on the gauze, you can remove the rubber drain using the suture scissors. You can just pull the rubber drain out. This side, you can just leave it for secondary healing, or you can put some holding sutures to approximate the wound. We have come to the end of our demonstration. I hope this video will teach you the basic steps in doing incision and drainage. Thank you.